Hi everybody, once again, we are also today with David Bong with us, and we want to talk about what? David?
Well, we're going to move to the medial aspect of the knee and talk about the medial collateral ligament, a little bit about the tendons which cross over and attach at the pes anserinus.
Pes anserinus is very tricky structure,
Well,
and it's very important also in this case a correct set of the exam and landmark identification and short and long essay study, and try to understand the clinical relevance of this anatomical structure.
Perfect. We're going to now move to the medial aspect of the knee. Again, very superficial structures, so our settings are very superficial with high frequency. So the first thing I do is I palpate, because it's more distal than you might imagine, the actual knee joint. So I want to find the knee joint, and here it is. So here is the femur, here's the tibia, and between the two is a nice hypoechoic meniscus. And then over the top you can see some linear structures. So the first linear structure is the first and superficial layer of the medial collateral ligament. Now remember, the medial collateral ligament is a very broad diamond-shaped structure, and it's very thin. And so the superficial portion is just this thin layer that crosses from above all the way to the inferior aspect. So that's the superficial. Now there's a deep portion here that inserts into the meniscus. So this is the meniscofemoral portion of the deep part of the medial collateral ligament. And here is the tibial meniscal portion. So this all together is medial collateral ligament. Now we can sweep the probe anteriorly and posteriorly to look at the meniscus. Now again, we're only seeing the superficial part of the meniscus. So you can see degenerative changes, you can see protrusion of the meniscus, but basically you're limited to that. Now, from here, we're just going to follow the bony acoustic landmark of the tibia distally, following the superficial part of the medial collateral ligament. And if we are very careful, we might see a very small pulsating structure right here, and this structure is a very tiny artery, okay? And this artery is the area where we start looking for a thickening of the medial collateral ligament. And this thickening represents the crossing of the tendons that eventually insert into the pes anserinus. Now this insertion is anterior and medial on the surface of the tibia. But the most important part for us clinically is where this structure crosses the ligament, because there's friction and you can actually have an irritation of these tendons or a bursitis in this area. So this is the area of interest as far as looking at this aspect of the ligament and the crossing tendons that eventually insert into the pes anserinus. So we're going to perform a video of the medial aspect of the knee. And the first thing is to identify the actual joint and the joint space. And here you see the femur on the left, the tibia on the right, and in between is the triangular shaped superficial part of the medial meniscus. Now, overriding this is a linear structure, which is the most superficial part of the medial collateral ligament. It's very extensive, extends from the very superficial part of the condyle down to the tibia. So it has a very long, thin structure. It's actually diamond shaped. And then below you have the deep portion, which inserts actually into the meniscus. So this is the meniscofemoral portion of the deep portion of the ligament, and this is the meniscotibial portion inserting here. And then you can scan anteriorly and posteriorly to get an idea of what the superficial part of the meniscus looks like. Now from here, we're going to follow the medial collateral ligament distally, and I'm just looking in the subcutaneous tissue under the superficial portion of the meniscus. I'm looking for a small artery, and I think it's right here, small pulsation, because this is where right above the ligament begins the tendons that are crossing obliquely to insert into the pes anserinus. And here you can see this thickening above, made up of the sartorius tendon, the gracilis tendon, and then the semi-tendinosus tendon, all insert into the pes anserinus here. Now, what we're looking for here is evidence of thickening of these tendons, possibly Doppler or possible fluid separating the tendons from the ligament, which would indicate an inflammatory process.